Welcome to Global View. Join us on this multi-visual journey around the world.
Today I'd like to provide an update to the American people on several decisive new actions we're taking in our very vigilant effort to combat and ultimately defeat the coronavirus. We've been working very hard on this. We've made tremendous progress. When you compare what we've done to other areas of the world, it's pretty incredible. A lot of that had to do with the early designation and the closing of the borders. And as you know, Europe was just designated as the hotspot right now, and we closed that border a while ago. So that was lucky, or through talent, or through luck, call it whatever you want. But through a very collective action and shared sacrifice, national determination, we will overcome the threat of the virus. I also announced Wednesday night, following the advice of our medical professionals, who are doing a tremendous job, and we appreciate it very much, that we're suspending the entry of foreign nationals who have been to Europe in the last 14 days from entering the United States. Citizens, permanent residents, and our families, any of the families returning from Europe, will be subject to extra screening as well as self-isolation for a period of 14 days. As the World Health Organization confirmed today, many of the things that what we said were 100% correct, including our designation before them of Europe. Like our earlier very aggressive actions with China, this measure will save countless lives. I appreciate a number of the folks behind me, number of the people behind me said that that saved a lot of lives, that early designation. But it is only the beginning of what we're really doing, and now we're in a different phase. We had some very old and obsolete rules that we had to live with. It worked under certain circumstances, but not under mass circumstances. They were there for a long time. They were in place for a long time, and we're breaking them down now. And they're very usable for certain instances, but not for this. To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and the side of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged.
I just chaired a meeting of the government's emergency committee, including ministers from Scotland, Wales and Northern Ireland, and it's clear that coronavirus, COVID-19, continues and will continue to spread across the world and our country over the next few months. We've done what can be done to contain this disease, and this has brought us valuable time, but it's now a global pandemic, and the number of cases will rise sharply. Indeed, the true number of cases is higher, perhaps much higher than the number of cases we have so far confirmed with tests. And I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous, and it's going to spread further. And I must level with you, level with the British public. More families, many more families, are going to lose loved ones before their time. And the Chief Scientific Advisor will set out the best information we have on that in a moment. But as we've said over the last few weeks, we have a clear plan that we are now working through. And we're now getting on to the next phase in that plan, because this is now not just an attempt to contain the disease as far as possible, but to delay its spread and thereby minimize the suffering. If we delay the peak even by a few weeks, then our NHS will be in a stronger state as the weather improves, and fewer people suffer from normal respiratory diseases, more beds are available, and we'll have more time for medical research. We can also act to stretch the peak of the disease over a longer period so that our society is better able to cope. The Chief Medical Officer will set out our lines of defence. We have to deploy these at the right time to maximise their effect. The most important task will be to protect our elderly and most vulnerable people during the peak weeks when there is the maximum risk of exposure to the disease and when the NHS will be under the most pressure. So the most dangerous period is not now, but some weeks away, depending on how fast it spreads. Today, therefore, we're moving forward with our plan. From tomorrow, if you have coronavirus symptoms, however mild, either a new continuous cough or a high temperature, then you should stay at home for at least 7 days to protect others and help slow the spread of the disease. We advise all those over 70 with serious medical conditions against going on cruises, and we advise against international school trips. At some point in the next few weeks, we are likely to go further, and if someone in a household has those symptoms, we will be asking everyone in that household to stay at home. We're not introducing this measure yet for reasons Sir Patrick will explain, but I want to signal now that this is coming down the track.